Hello everyone, welcome to my YouTube channel. My name is Onesimus and you're on Onesimus the Fashionable Nurse. In this tutorial we are going to look at diagnosis, management and prevention of typhoid. We have been sharing about typhoid from the beginning. I've been posting short videos about typhoid, and for those ones who would like to watch those videos, please I've shared with you a link in the description down here. Click on that link, it will take you direct to those videos. And this is the last video about typhoid. And if you know you are new on this channel, please consider subscribing by hitting a subscribe button down in the corner here and click on the notification bell so that you will be the first person to receive the videos whenever I post. Thank you. Now if we are to look at the diagnosis of typhoid, there are very many tests that can be done to confirm typhoid, but the following are the common ones. They are always used in order to rule out typhoid. Number one is bone marrow test. This is considered to be the most sensitive and specific test. But the problem with this one, and the reason why they don't always do it, it is too painful and it is time consuming. Then another test is blood culture. This is commonly used in developed countries compared to developing countries. Blood culture is considered to be also sensitive and specific. Then we have also stool culture. Stool culture is also sensitive, but it is not specific as blood culture. Then we have WIDO. WIDO is less used in developed countries compared to developing countries. Those are some of the tests that can be done to confirm typhoid. Now, if we are to look at management, of course, like any other disease, before you manage, you have to set goals. You have to set goals as to why you are managing. What are you looking at in your management? So in typhoid, the number one goal is control fever. We saw that in patients who have typhoid, their cardinal sign is fever, which keeps on increasing gradually. So the number one goal is to control fever. Then secondly, maintain food intake. We saw that these patients will present with diarrhea and vomiting, so they will be losing water. So one of our goals is to make sure that they replace the water that they have lost by maintaining the food intake. Then thirdly is control pain. We saw that these patients will present with headache, will present with stomach pain. So one of our goals should be controlling pain. Then also nutrition intake. We advise our patients to take nutritional food. As we saw that they will be presenting with nausea and vomiting, they will be losing electrolytes. So we help them to take nutritional food. Then lastly, we help them to continue with their daily life. Then if we are to look at the nursing management, we should be aiming at meeting our goals. We should manage aiming at meeting our goals. So in this situation, we shall manage these patients in this way. First of all, pain management. For example, you can help the patient to get enough rest and apply the cold compress in the paining areas. And also you can administer analgesics as prescribed. For example, diclofenac. Then also control fever by applying tepid sponging, then also bed bath. Then you can also administer antipyretics as prescribed. For example, paracetamol. Also, help the patient maintain fluid intake. As we saw before, that the patient will be losing water through vomiting and diarrhea. Advise the patient take enough oral fluids, or if the patient is severely sick, set an IV line and administer fluids as necessary. Then lastly, you can also help patients to meet their daily needs. For example, helping them in their hygiene. If we are to look at the medical management, infection is managed with one of the following: either tabs, ciprofloxacin for 10 days, or cefixime for 10 to 14 days, or fluoxacin for 10 days, or IV ciprofloxacin for 10 days. But in persistent infection, we can give azithromycin 10 to 20 micrograms per kilogram body weight per day. Then in severe infection, we can give IV ceftriaxone for 10 days or cefotaxime for 10 to 14 days and dexamethasone. Or we can also give meropenem. Then in chronic infection, typhoid is considered to be chronic following a positive stool culture test after 12 months. So when this happens, a chronic typhoid is treated with IV Cipro for 6 weeks. Now we look at prevention. For us to avoid all these problems, for us to avoid typhoid, number one, we have to be eating hot food. We avoid cold food. Secondly, we need to be taking only bottled or boiled water. Also, we need to be washing vegetables and fruits very well before eating them. We should avoid salads. We should avoid salads because you cannot know how they have been prepared. Then lastly, vaccination. You should get vaccinated if you can access the vaccine in your country. Before you travel to endemic areas, you should be vaccinated. But this vaccine does not guarantee full protection from Salmonella typhi. We have reached at the end of our tutorial, but please remember this is not an online clinic, and these views in this video are my own views, and I don't reflect my employer's views. Thank you for watching this video. Don't forget to subscribe, like, and please, in case you want to share with me something, put it down in the comment section. And if you find this video helpful someone else, please don't forget to share. Thank you.